active straight leg raise.
Now this one's not part of the cluster of 5 tests. By itself, it's a pretty good test, and we think that it applies for non-pregnant individuals, even though it's only been studied for posterior pelvic pain in pregnant women. That was the journal article, posterior pelvic pain. And that's what people call SI joint pain who are non-committal. The SI joints actually, in some people might be fused. So in a lot of people that might be fused, especially over the age of like 30 or 40. You might have one fused, both fused. So posterior pelvic pain is probably a better way to describe it because that's really where they're feeling it anyway. And when somebody lifts their leg, this is an active straight leg raise, when you lift your leg, you got a large amount of leverage, your entire leg. And when you're only lifting it a little bit, probably no structures are stressed at all. But what should happen because of all that leverage is when your brain decides, when you send efferent motor signals out for your hip to flex up like that, to about 4 inches or so above the table, your nervous system should fire all the muscles that contract around the pelvis. And when that happens, your SI joints should lock together. That's called a forced closure. And when you get that forced closure, your SI joint's incredibly stable and not moving, and you can lift your leg without creating a lot of strain at the SI joint. If that doesn't happen, you lift your leg up, you feel in the SI joint, because you're not getting that forced closure. So what does that tell us? Yeah, something's happening where those muscles aren't doing their job to close that SI joint. So we call that functional instability. It's not unstable because there's a bunch of like torn ligaments or a bone's broken or something. It's unstable because those muscles aren't really doing their job. They're not locking that SI joint down the way it's supposed to lock. So the test is, just go ahead and look at your feet for a second. I'm going to put my hand right there, and in a second you're going to keep your leg straight and bring it up to touch my hand. But I want your head to be on the table when you do this. This is important. You don't want to pill underneath the head, and you don't want the neck flexed. When you do that, you lengthen the spinal cord, and it creates a lot of tension. And I can completely change this test. So go ahead and bring your leg up slowly until it touches my hand. There we go. Back down. Now the other side. Back down. Any pain with that? If there's not pain with that, we bring it up another 4 inches. Go ahead and bring it up until you touch my hand. There we go. And on the other side. Okay, good. Back down. Any pain with that? So let's say there was pain. Where would we expect it? Probably SI joint. And what we'll do, go ahead and bring your hands on. There we go. I'm going to compress the SI joints, very similar to what we did in the compression test, a little bit different because I can't necessarily get my hands in the exact same spot. But I'm going to lock the SI joints down and have her do it again. So I want you to do it this way. You're going to put your hand right on the innominate on this side and anchor this elbow in your thigh or in your ASIS. And then the other hand's going to come in like this. My forearm's going to go over the belt line, and I'm going to be squeezing together like that. So now go ahead and lift that leg up a little bit. There we go. And the other side. And if there's functional instability, when I do that, that's going to help. And the pain's probably going to go away. In addition to pain, we might also have a sense that it's harder to do that on one side versus the other. Or it feels different on one side versus the other. Or maybe you can't lift it as high on one side versus the other. So in addition to following up about pain, you might just want to ask afterwards, did one side feel different than the other? And very often if you ask that, you're going to have the patient do it again. Because they'll be like, it wasn't really pain, close tension. Okay, bring it up to my hand. And then down and up. Did that feel different? And if they say no, and there was no pain, then that's negative. If they say yes with any of those, whether it's pain or just different quality, lock the SI joints down, see if it feels better. If it feels better, that's a good indication that there's some functional instability going on there.
So we're only doing that second part where we're